Let's stay with health updates, nevertheless. And parents whose children have medical conditions that compromise their immunity are finding the return to school during the COVID-19 era a risky undertaking. And as Raquel Muigai reports, the family of Milton Odinga, a sickle cell patient here in Nairobi, is taking it one day at a time and trying not to think too much about the risk the school setting poses to their son. Let's examine now the challenges faced by students with underlying conditions through Milton's eyes in this next report.
The yellowish discoloration on the whites of the eyes is just one of the many symptoms of sickle cell disease that 14-year-old Milton Odinga has had since birth.
Sababu hii sickle cell huwa imenisumbua miaka na hiyo saa kifua sasa ikiniuma huwa nashindwa kupumua na kifua inauma both sides.
Kila mwezi like last month amekuwa na crisis almost 5 times.
But with the situation changing owing to Milton having to attend school to prepare for his national examinations next year, his family cannot help but worry.
Kijana akiwa kule shuleni sioni kama akiwa safe sababu kuna shida. Mimi nikiwa hapa mimi mwenyewe mchunga namwambia kwamba usicheze huku, usiende huku. Saa zingine tunakaa indoors.
A difficult situation that Milton knows all too well.
Sasa corona hata ukiwa shuleni huwa na wasiwasi sababu watoto wengine huwa kama mwalimu ametoka dakika kidogo wanakuja wanakaa na wewe wanaanza kukuambia mastori zingine. Sasa unakuwa na wasiwasi kwa sababu wa maintain social distance.
According to Dr. Grace Kiraka, a clinical pathologist specializing in hematology and blood transfusion, patients with sickle cell anemia are at risk of having severe complications if at all they contract COVID-19.
The one with sickle cell already has some organ damage because of having these red cells which have been blocking the veins since they were born. So one of the organs they will block is the lungs. So patients with sickle cell do get pneumonia, they get something called acute chest syndrome, they get pulmonary hypertension, increased pressures in the lungs. So already the lungs are not as healthy as for a child who doesn't have sickle cell.
Sickle cell anemia is a genetic disease that affects the red blood cells. In this case, the red blood cells appear to have an abnormal crescent shape, resembling a sickle, different from the ordinary disc-like shape.
And because they're abnormally shaped, they get stuck in the blood vessels. They don't flow properly. So this stacking or sticking is actually what causes what we call a pain crisis, which is a very, very severe pain. They get back pain, joint pain, pain in their hands, and they have to be treated with very strong medications. The other thing is because now the red cells are abnormal, they're destroyed more quicker, they don't live as long. So patients with sickle cell will also need transfusion throughout their life so that they can have a normal life.
With extreme temperatures being cited as triggers for any sickle cell patient, Milton's school reporting time is unpredictable.
Ikifika asubuhi ya kupatikana kuna crisis ya hezi amka hezi pumua inabidi akae nyumbani, jua linapochomoza ndiye afanye nini, aende kule.
At his school, teachers indicate that Milton's health is top priority as there are no other pupils in the school with an underlying condition.
Kama darasani Milton kama hayuko sawa, mara nyingi huwa anashika kifua na anaanza kulia ama lala juu ya dawati. Kisha mwalimu ambaye kwa darasani atajua Milton si sawa, atatuita walimu wengine.
Milton is among thousands of students with underlying conditions and whose parents have taken the step of faith to allow them resume school. But despite the anxiety that comes with such a situation, it will take the entire school community to safeguard the health of such students. Raquel Muigai, Citizen TV, Nairobi.